There's people who are cautious and are masking all the time and are doing so regardless of any public health advice. There are people who are not masking regardless of the public health advice. And there are people who are following public health advice to the letter. So those are the people who will doff their masks after this CDC guidance becomes official. And that third group of people is actually relatively small. And so that combined with the fact that the official advice is sometimes contradictory between local, state, and or national levels. I just really think that the practical impact of the CDC guidance change that's imminent is not going to be great where the rubber meets the road. I would like to see, the most masking when we really need it, when there's another wave of COVID, potentially, next fall. So after Thanksgiving of 2022, it's very likely that we'll need to ask people to put their masks back on, and it's just more likely to happen if people get some summer months off than if we just say mask all the time. If we have continual masking orders, they might become a total joke by the time we really need them again. And so I think it makes sense to keep our powder dry, so to speak. I think today's change is going to have a rather modest effect, all the more so because the CDC guidance is not always aligned with local and state guidance. And so there's even more confusion.
This is the way we need to go. I think this is taking us forward with a new direction going into the pandemic, but we're still focusing on safety. We're still focusing on preventing death and illness. What I like is the average person can now decide for themselves. If you see that your community is starting to drift up into kind of a higher level of concern, then you can take steps such as starting to wear masks more frequently, upgrading your mask and having a really good quality mask, perhaps even if things get bad, limiting your contact with other people. If we had a surge of some kind in the fall, and it weren't causing severe illness and we weren't seeing a lot of hospitalizations, then many localities may stay in these kind of mild to medium areas, and we might not have to put back in some of the requirements or mitigation strategies that we've had to do in the past. So that's, that's a real scenario now. Most of us are not quite optimistic to think we're not going to see any more COVID. I mean, I think there's going to be some more surges, but the question is, are we getting to a place now where severity is going to be less? But we'll be able to monitor that closely. I think that the systems to really track hospital disease and severe disease are well put together now, and so and it just allows for a much more much more finessed approach to when we need to make changes because of the current manifestations of COVID and of the pandemic.